Hi guys. So we've been talking about a lot of interesting things in my classes this week. And in my health psychology class, we brought up certain topics and it had to do with like communication between providers and patients and like difficulties with communication between providers and patients. And it just brought me back to like all of the experiences that I've had as a person with a chronic illness who is constantly having to go see providers, especially when I was having like all the problems with my seizures and the mini strokes and the actual stroke that I had, and kind of what I want to do when I become a provider, because I haven't decided if I want to do like occupational therapy, speech therapy, physical therapy, if I want to go to medical school, or if I want to go to PA school when I'm done with this degree. Um, and I've also had people ask me if it's possible to get into PA school or medical school when you've done like a public health degree. Yes, it is. You just have to be careful with what the prerequisites are for whatever program you're trying to get into. I can go into further detail on that if you'd like in a future video. Um, so I haven't quite made that decision yet. I'm leaning more towards PA just because I'm going to be 32 in a couple months and um, it's my life is not getting any shorter. We'll just say that. And a PA program is not as time intensive as medical school. And by that, I just mean PA school doesn't take as long as medical school to get through. You don't have to go to PA school for as many years as you do medical school. Um, so I just really, I want to be that type of provider who's going to actually make the effort to listen to my patients. I want to make sure that my patients feel valued, because we did a discussion post and it was mainly focused on communication issues between patients and providers, like I was saying. And I brought up the fact that, there's been many times where because I have PTSD and anxiety, that I have felt like how I feel or what I'm describing to providers didn't even matter, because they automatically think that it's a mental thing. They don't even begin to consider the physical symptoms that you're experiencing. They just feel like, oh, she has PTSD. Oh, nothing could be wrong with her, which is totally untrue. There's a lot of people who have PTSD. Anybody can get it. And I just want to make sure that I'm the type of provider who my patients are going to feel like they've been heard. I want to not be someone who's condescending to my patients. I want to actually make a difference in their lives. I want them to keep coming to me. I don't want them to, when they leave from seeing me, I don't want them to feel like they haven't even been able to voice their concerns, like they've just been kind of rushed through everything and pushed to the side. I want to make sure that I am going to help them create lasting change for their lives, because I feel like that's the most important thing when you're doing any sort of like health behavior change, which we've also been talking a lot about the last couple of weeks in my health psychology class, as far as like how you get people to stick with changes, whether that's changing their diet, not smoking anymore, etc., etc. But I just want to feel, or have my patients feel that, they don't have to worry about me pushing them to the side, because one, I've been in their shoes. I know what it's like to feel like you've been pushed to the side, like your thoughts and opinions about your own body, your own physical health or mental health doesn't matter. Um, and I want to actually work together with my patients to create a treatment plan that, they're more able to stick to, something that's realistic for them, and have it like gradually progress. Like if it's something where they need to change their diet to try to lose weight or something like that, start with little changes and continue to follow up with them to help them make the more longer term, blah, 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 the more longer term changes. So then I feel like when you work with your patients and you're more of a team and you're not just telling them, oh, this is what you need to do. Here's this, here's that. This is what you need to do. Listen to me. I'm the doctor. I know what's best for you. Like, no. um, while you might have the medical knowledge that this person may not have, that doesn't mean that you know what's best for the person. You try to offer them advice with your best medical judgment, but that doesn't always mean that it's what's best for the patient. Ultimately, that's the patient's decision. And I just feel like when you work together as a team, instead of having the provider tell you everything that you have to be doing, I feel like the patient is more apt to stick with those changes and more apt to actually continue positive changes in their life. But like I said, I don't want to be that type of provider who's sitting there like, oh, you're fat. It's because you're fat. Like, I've had those experiences. If you've been on my channel following me for a while, you know that um, before I was diagnosed with MS, I was in a lot of pain all the time. And I went to go see a doctor at a clinic that works with people who have financial difficulties. They had the sliding fee scale or whatever, however you say it, sliding scale fees, whatever. I don't remember. But it's more for like people who have little to no income and you pay based on your income. So I went in there to ask if I could get a referral to get either x-rays or an MRI done of my back, my spine, because I was very much in pain. Like, I couldn't even bend over to touch my toes. I couldn't even pull my pants up. Even standing up just hurt. And I knew there was something wrong. And the woman literally, she was a doctor, not an NP or a PA. She was a doctor, came in the room, told me to lay down on the exam table. And she said, lift up your leg. So I lifted up my leg. She said, lift up your other leg. So I lifted up my other leg. And it hurt a little bit, but not as much. And I feel like that's probably because I took ibuprofen before I went to the appointment. But then she had me bend over and she was like feeling my spine with her hand. And she's like, nope, there's nothing wrong. You're just in pain because you're fat. Literally. Literally, I was so frustrated because, yes, I'm overweight, but that doesn't mean that all of my health problems are because I'm overweight. Most people who are overweight like me end up with respiratory, cardiac issues, all of that good stuff. Not good stuff, but you know what I mean. And I don't have that. I'm not diabetic. I don't have, respiratory issues other than my asthma that I've had since I was in middle school. So most people, when they see me and they see that I'm not diabetic, I don't have these major issues that most people who are overweight like me do have, or I should say a lot of people who are overweight like me do have, they're surprised. But I said all that to say, I don't want people to be going through the same BS that I've had to go through. And that's why I want to make sure that I'm learning how to be a better provider. I like the program that I'm in because from the standpoint of someone who plans on becoming a provider after I get this degree, I feel like it's preparing me to see things more as a whole, focus on the whole body, like mental, physical, spiritual, everything, and not just physical. I don't want to be the type of provider who is just focused on the physical and not focused on, the mental, the spiritual, all of that stuff. It all matters. It's all integrated together. If one system is off, the other systems are off. It affects everything. So this video has gone on long enough, but I hope you kind of got the gist of what I'm saying. I don't want to be that type of provider. I want to be someone who my patients are happy to come to, who feel valued and who feel listened to. And I want to be somebody who works together as a team with my patients, not just tells them what to do. So anyways, if you'd like to hear more about my future plans, let me know. I can definitely make a video about that. And next week I get to register for my classes for next term, so I will update you guys with what classes I chose. Full-time at my college that I go to is 4 classes per term. Terms are 10 weeks long. I am going to try 3 classes just to see how I do. Right now I'm doing 2, obviously. I'm going to try 3 classes next term just to see how I do. And then if I feel like it's too much for me, I'll drop back to 2. If I feel like I can handle it, I'll probably bump it up to 4, just because I want to get it done as quickly as I can. So I'll let you guys know as that happens. But that's it for right now. So I hope you guys enjoyed. Like I said, if there's anything you want me to talk about in a future video, please leave it in the comments or send me a message on Instagram or Facebook, and I would be glad to get it filmed for you. And with that, I will see you guys again in my next video.